Hello viewers, my name is Dr. Mary Runo, a specialist in the area of learning disabilities and intellectual disabilities and developmental disabilities. I've specialized in the area of cognitive disabilities also. Today we want to talk about special needs, an area that has not been understood by many parents and teachers. Every time you talk about special needs, a parent or a teacher will tell you, we don't have such children. It is not about the term, it's about helping the children. So I want to talk about the essence of having to look at your child differently. All children, whether they were born normally or not, they are important, they matter. And we don't have to wait until we are told that the child cannot manage. So that's why specialists in the area of special needs are very important. And I want to say that special needs is an integral part of regular education. And because regular education is quite a wide area, most of the trainees and the training colleges, the teacher training colleges, including universities, they do not focus on special needs. So you'll find that either a university has a branch in special needs or a department of special needs, or the teacher training college has an element of special needs, but they don't get into it fully. Because of that, you'll find that the teacher who has been trained as a good teacher or has gone through the entire program of a professional teacher will still be having problems with children who are away from norm, children who deviate from norm. So I want to talk about special needs. In our field, some people will call this child as having special needs. Others will talk about disabilities, but I'll prefer talking about special needs because disabilities are actually part of the special needs, and special needs is wider than just disabilities alone. As we continue, I'll talk about the essence of including these children fully in our society and fully in our home and school. These children are born in a family where there are other children who are growing normally, and therefore they should be in regular schools, or even if they're in special schools, they should not remain in special schools forever unless the condition is very severe. Basically, we have gone inclusive education, and we are saying that every child can learn in a regular school as long as the teacher is specially trained. The regular teacher does not have to have 100% course, all the courses in special needs. And that's why we are here to give the tips of what a teacher can do and what a parent can do so that this child is well accommodated at home and in school. To be an effective teacher, you need to familiarize yourself with different types of special needs, whether in terms of disability or the child is gifted. And many people will come to you when they know that you have an extra knowledge of a child who is not learning normally. Like, for example, you find a child in PP2 or PP1 who is not concentrating. Of course, the child is still very small, but their level of concentration is way, way, way below others. Or maybe she is too active, what we call hyperactivity. Maybe she's too active or he's too active to a point where he is more destructive and he can't settle down like the other children. That is a child you should worry about. Or maybe the child in PP1 or PP2 or primary 1 is not able to, or grade 1 is not able to express himself or herself fully. And yet, at this age, all other children are expressing themselves. So even though we are not comparing that child with others, you can actually tell as a teacher, this child is way above or way below the other children, and therefore there is a concern. Way above means also is a problem. Maybe she's doing better than all the others in terms of language, in terms of reading. Maybe she's reading in a level that is above by almost 2 grades. You need to be concerned with that child. If you're not concerned, what will happen is that child will get tired of reading the same things you are teaching the PP1 or grade 1, and they will stop learning. If the child is below others, and they are not catching up, they reach a point where they also get frustrated. Most of the time you find that that child is not asked questions, they don't participate in Q&A session, that is question and answer session in class. Sometimes they are not even participating in activities that are normally given in a class, whether it's an activity at the corner, maybe interest corner or shop corner or home corner, and they are not participating and they are not actually interacting with the other children. There is a concern. Or maybe this child is always fighting with others. He's too small even to be fighting, but he's always getting into a quarrel with other children. There is a concern. Or maybe the child is in lower primary and is not yet toilet trained. What other areas is the child delayed in? It's a concern. So we want to talk about the various types of disabilities and children with special needs, one at a time, so that at least by the end of the day, every teacher and every parent is aware that if my child is away from the norm, I can still get help. The issue of assessment is such a big issue. Because if you find that a child is actually not growing normally, the language development is not normal, the physical development is not normal, the social development is not normal, the behavior is away from the norm, it is important to get that child assessed. And the reason why we are giving these tips is so that all of us can help our children, so that we don't have to wait for 8 years or 6 years to be told that your child has been having special needs and they could have been helped 10 years ago. We don't want to do that, because we know very many children today they are adults. They would have been helped if they were assessed early, if they were identified early, and if the teachers and the parents knew what to do. Reason why, as a specialist, I'm coming to you to tell you that let's look at our children in class. If there's a child who is away from norm, what is it that I can do? If there's a child who is not behaving in a certain way, what is it that I can do? What are some of the things that cause the children not to learn properly? Why are the children struggling? The statistics say that up to almost 30–40% of children in schools are struggling in learning. We don't have to leave them out. As a matter of fact, we can have zero to struggle. We can have so many children helped instead of waiting until we are told this child could not manage. And even with the CBC, CBC is a good system. However, even with the CBC, I can tell you for sure, if the teachers and the parents do not know how to identify these children, they will still be having problems. So my take today is to talk about special needs, and we are going to start with specific conditions. And for now, we want to stop there as an introduction, and then we move to the categories. And we are going to look at those who have ASD, autism spectrum disorders. That is what we are going to start with. We are going to start with autism spectrum disorders. We are going to go to specific learning disabilities. We are going to go to intellectual learning disabilities, a session of its own, so that those who are interested in a specific condition, they can ask questions later on, or they can follow us in our YouTube on how we can help children of that nature. Thank you.